Hey everyone, it's Dr. Morales again. Just continuing a series of plastic surgery questions and topics. Question for today is the benefit of extreme weight loss and skin excision. So, people who have, trouble losing weight and they get to the point where, they've tried all diet and exercise and they just can't get to that point of losing all the weight they want for whatever reason. Either they're just done with the weight or they're having medical conditions associated to being a little heavier, diabetes, high blood pressure, cholesterol issues, just general health, not being on the move, and having rashes. I've seen that, rashes from folds and stuff like that. Some patients consider having, massive weight loss surgery. Do I agree with it? It works for a lot of people. The diet and exercise route takes years. It can be done. It just takes a little bit longer. Has a little bit more of a demanding, I would say, mindset. If you're going to choose, gastric surgery, which I'm not opposed to, just make sure you find the surgeon that does it often and has good results. Really focus on patient care and the nutritional aspects and consequences associated to gastric surgery. So the most common one I run across from patients who come see me are patients that have like a gastric sleeve. It's probably the most common one I would say right now, which is basically a sleeve that goes around the stomach and it decreases the size of the stomach so you can't eat quite as much, you get full faster. And so you can significantly decrease the amount of calories you take in a day. So the end result is that there's a significant amount of deflation, the deflation of fatty tissue. So the consequence of that is, the gastric surgeon told you, is that you will have extra skin. This is gonna happen. Once the skin has been stretched out, I would say almost always, there's gonna be some kind of skin damage where the skin has been permanently stretched. You have stretch marks, the collagen is stripped out, and it does not have the retractability to kind of shrink down to a smaller size. When that's the case, and patients' weights are stable, and they're done losing the weight, that is when you go and discuss with the plastic surgeon, what kind of massive weight loss surgeries can be done. And the weight changes associated to significant deflation are the arms, the thighs, the breast, the back, the abdomen. I've seen face, neck. It varies per patient how much weight you've lost, how old you are, and a couple other factors. But what we do as plastic surgeons, we remove the extra skin. We try to hide the scars in seams of, for suits, pantsuits, things like that. We try to conceal the scars as best as possible. And the purpose of it is you get a better contour. So, that's kind of what you're wearing, is a big skin suit when you got to retailer you down into a smaller, kind of tighter form and function. So we do everything we can, obviously, to make the scars appear as less visible as possible and look the best it can. I do, several things to make sure we get better scars. But it's really just you don't have extra skin flapping around anymore. It's all over with. So there are some benefits to to the massive weight loss surgery. Not just contouring wise from plastic surgery, but really that typically the health benefits are pretty significant. I've seen patients have been cured of diabetes. Their blood pressure's better, they're feeling better, they're exercising, actually exercise, move their body, versus the difficulty of when you have a little more weight on. So anyway, that's kind of weight loss and plastic surgery and how we're kind of mixed together in a nutshell. Hope you learned something. Thanks for following.